My name is Rochelle Davis, and I'm President and CEO of Healthy Schools Campaign, and it's quite honored to be invited to share with you some of the work that we have done to successfully develop cross-sector partnerships and work to incorporate health and wellness into education policy and practice. I wanted to start by just telling you a little bit about Healthy Schools Campaign. Healthy Schools Campaign is based on the very simple and common sense notion that healthy students are better learners and that health and wellness should be incorporated into all aspects of the school experience. We are based in Chicago, and we are Chicago focused and nationally minded. And what that means is that we work at a school and a community and a family level in Chicago to make changes in schools, communities, and the broader school district, and then we take those lessons and elevate them to both state and federal policy issues. At the heart of our organization and a core part of our mission and vision is to really is to address the disparities that exist, not only on the health side, but also on the education side. And we truly work at the intersection of health and education. It's kind of, we're not fish or fowl, we're kind of work right squarely at that intersection, and my staff have a wide range of backgrounds that contribute to that kind of very multi-sector approach. In Chicago, just a few minutes about, or hopefully just 1 minute about our work in Chicago. We've really focused on the issue of changing the food and fitness environment, and in the last 3 years, we have challenged and supported Chicago schools to meet the USDA's Healthier U.S. School Challenge, which is improving nutrition, physical activity, and nutrition education. And we have had over 200 schools make those changes, representing about 40% of our elementary schools, and directly impacting 90,000 students. So this year, 90,000 students went back to school in a school environment that was significantly more supportive of healthy eating and physical activity than it was 2 or 3 years ago. And on top of that, and clearly with that level of change, we began to have impact on district policy. So there's been a tremendous change in the school food environment with high nutrition standards that often exceed the Healthier U.S. School Challenge, a very extensive local and sustainable procurement program. We have breakfast in the classroom in every elementary schools, and we even brought back recess, which actually turned out to be practically the hardest part of that. You never take anything for granted. So in our work, what we really do is work to connect the work that we do to education goals. And when you work and talk with educators, they talk about improving student growth and development, and they talk about addressing the achievement gap. And we're very fortunate that a few years ago, Dr. Charles Bosch from Columbia Teachers College issued a report called Healthy Students Are Better Learners, in which he really documented this connection between health disparities and the achievement gap. And Dr. Bosch identified 7 health conditions that have a strong impact on learning, in which there is high prevalence among students, and in which there are great disparities, and there are proven best practices for schools to address those things. And through his work, he really has documented the connection, and you know, really the conclusion is that for the education sector, if they want to address the achievement gap, they are going to have to address health disparities. Otherwise, all of the investments that they make will certainly be less effective. And some of this conversation about linking health disparities to the achievement gap is beginning to get some traction. Earlier this year, the Equity and Excellence Commission at the U.S. Department of Ed released a report which was designed specifically to address equity in education, and they identified student health as a critical area that schools are going to need to figure out how to address. As we have come to learn about the education sector, we've really focused on a number of their key strategies to figure out how can we connect our concerns about health right into the kinds of strategies that the education sector is looking at. So the three that we focus most on is data-based decision-making, transparency, and professional development. So in terms of data-based decision-making, there's really a strong sense that American education needs a system for knowing when they are succeeding, when they are improving, and where they are struggling. So significant focus is being placed on developing data systems to provide that analysis. For example, most states are developing longitudinal data systems to track students over time. To date, these data systems have almost exclusively focused on a very narrow set of desired academic competencies. So given the impact that student health has on academic performance, we're trying to make sure that this information about student health and about how schools support student health should be part of that analysis. Otherwise, they will miss an important set of information critical to supporting student success. The other area that education's very focused on is the issue of transparency. We all know that report cards have been a long part of students' experiences, as have grades and tests. But within the past decade, these gauges have been used to measure schools' performance, often compared to other schools in the district or kind of the average in their state. However, very few of these report cards include anything connected to health and wellness. The third focus for the department, for the education sector, is really professional development. They are taking a hard look at how it prepares teachers, principals, and administrators to meet the needs of students today. As this rethinking is taking place, we want to make sure that educators have the knowledge and skills to support student health. So I'm going to share with you a couple of examples of how these ideas are being put into action. So, in terms of data-based decision making, Texas right now mandates that states annually assess students in grades 3 through 12 on their physical fitness, and then when they compile that information, they compare that to determine the relationship between student academic achievement, attendance, obesity, disciplinary action, and school meal programs. At a federal level, we're in conversations with the Office of Civil Rights, which has one of the most comprehensive set of data on schools. The information that they collect is used to document and address inequities in educational opportunities, yet there's virtually no data on student health and well-being that's being collected. So we're in discussions with them about including questions about schools' ability to support student health. Our recommendations include facilities, food and fitness, and health services. And finally, on professional, on transparency, I'm going to go to next. As schools are putting out report cards either at a district level or at a state level, we have worked to integrate health and wellness. In Chicago, we've been very successful. This is a copy of the Chicago Public Schools report card for schools that goes to parents and is publicly available. And we were successful in getting a Healthy Schools certification on that report card, and you either get a yes or a no. And I can't tell you the impact that that has had, and it is clearly one of the reasons that more than 200 schools across the district decided to take this path to wellness. We also are working with the state report card. When legislation was introduced to authorize the State Board of Education to update their school report card, we were successful in requiring them to include a health and wellness metric. Now we're working with the State Board of Education on developing that metric. There are a lot of challenges to creating these kinds of metrics, and obviously that could be a topic of a whole other discussion. And finally, around professional development. In Chicago, we offer a program called Fit to Learn for teachers and principals on how to incorporate healthy eating and physical activity into the classroom. The training provides participants with the research basis for linking health and learning and focuses on strategies for incorporating nutrition education and physical activity into lesson plans. And finally, just a comment about resources. Schools are underfunded and they need more resources, so we really look to leverage money to meet goals of multiple sectors. In terms of health, as we move to a health system that focuses more on treatment of disease to one on prevention, schools and their ability to reach students will be greater importance to the health sectors. Schools obviously want to make sure that students are there and ready to learn, yet there are many barriers that schools have in accessing resources from the health sector. So towards that end, we're advocating for changes to the Medicaid reimbursement rules to make it more possible. And finally, in Chicago, we are launching a program called Space to Grow to redesign Chicago schoolyards to provide places of active play and outdoor education. And we're partnering with the Metropolitan Water Reclamation District and the Chicago Department of Water Management to build these playgrounds to be green infrastructures and to help solve our city water, stormwater management and basement flooding issues. Finally, we are working with the Department of Ed on a program called the School Improvement Grant Program, which is a $5 billion program to support the 5,000 lowest performing schools. And we're in the process of helping them make some changes to that program so that really health and wellness is incorporated into that. We have had some success in raising these issues at a national policy level and had a very successful event with Secretary Duncan and Secretary Sebelius with recommendations for what we saw their departments do and are actively working with both agencies. And more recently, we have been going beyond just what the federal government to do to more sector level change and have a working group on health and education that was formed in response to a charge from the Surgeon General, and I'll be presenting recommendations to the advisory group next week. So I want to thank you very much for letting me share this with you, and I look forward to the discussion.
So we've heard about transportation, planning, and education, and now our final speaker is going to focus on land use. And Kathleen Dickhut is the Deputy Commissioner at the Chicago Department of Housing and Economic Development, and she leads the office on, or the division on sustainability and open space, and has thought a lot about some of these health-related issues.